failure, or decompensatio cordis, is a chronic condition where the heart struggles to pump enough blood to meet the body's needs. For those diagnosed with heart failure, the physical challenges are significant. However, the emotional and psychological toll of living with a heart condition is often overlooked. The relationship between heart disease and mental health is complex, and for many, managing the emotional impact of heart failure can be as difficult as dealing with the physical symptoms. In this video, we will explore the psychological effects of heart failure, how it affects mental health, and practical strategies to manage stress, anxiety, and depression associated with heart disease. The emotional burden of heart failure. Being diagnosed with heart failure is often a life-altering event. Patients face not only the physical symptoms of the disease, such as shortness of breath, fatigue, and swelling, but also a range of emotional and psychological challenges. The uncertainty about the future, the limitations imposed by the disease, and the constant need for medical monitoring can lead to a feeling of helplessness and fear. The emotional toll of heart failure is compounded by the reality of living with a chronic illness. Unlike some acute conditions, heart failure is often ongoing, requiring lifelong management. For many, the initial diagnosis comes with a sense of shock, and this can spiral into anxiety about worsening symptoms, hospitalizations, and even the possibility of death. Studies have shown that patients with heart failure are at a higher risk of developing depression, anxiety, and other mental health issues compared to the general population. What happens to the body with heart failure? Heart failure affects the body in several ways. It primarily occurs when the heart can't pump enough blood to meet the body's needs. This can lead to symptoms like fatigue, shortness of breath, and fluid retention, swelling in the legs, ankles, or abdomen. Over time, the heart muscle becomes weakened or stiff, and this affects the ability of the heart to fill with or pump out blood properly. In addition to these physical symptoms, heart failure can cause damage to organs and tissues, as less oxygenated blood reaches them. This can impair the function of kidneys, liver, and other vital organs, leading to complications. For example, fluid buildup in the lungs can lead to difficulty breathing, while reduced blood flow can affect digestion and kidney function. Medications for heart failure. Managing heart failure typically involves a combination of lifestyle changes and medications. Common medications prescribed for heart failure include ACE inhibitors, beta blockers, diuretics, and in some cases, blood thinners. These drugs work by helping the heart pump more efficiently, reducing fluid buildup, and preventing further damage to the heart. ACE inhibitors help relax blood vessels, reducing the heart's workload. Beta blockers lower heart rate and blood pressure, which can help the heart pump more effectively. Diuretics remove excess fluid from the body, which can reduce swelling and ease breathing. Blood thinners help prevent blood clots from forming, which can be a risk in heart failure patients. It's crucial for heart failure patients to work closely with their healthcare providers to find the right combination of medications that works for them. The role of social support in mental health. Support from family, friends, and healthcare professionals plays a vital role in managing the emotional burden of heart failure. The social isolation that often accompanies chronic illness can worsen feelings of depression and anxiety. Patients who feel unsupported or misunderstood may withdraw from social interactions, which can lead to feelings of loneliness and despair. On the other hand, having a strong support network can provide reassurance, boost emotional well-being, and improve adherence to treatment plans. Family and friends can help monitor symptoms, encourage healthy lifestyle choices, and offer emotional support during difficult times. Additionally, participating in heart failure support groups, either in person or online, can provide patients with a sense of community and belonging as they connect with others who understand their struggles. Cognitive behavioral therapy for heart failure patients. This is a well-established therapeutic approach for managing mental health issues, including depression and anxiety. CBT helps patients identify and change negative thought patterns and behaviors that contribute to emotional distress. For heart failure patients, CBT can be particularly effective in addressing the psychological impacts of living with a chronic illness. In CBT, patients are encouraged to challenge negative thoughts related to their heart failure diagnosis. For example, a person might think, "My heart failure will only get worse," which can lead to feelings of hopelessness and anxiety. Through therapy, patients can learn to reframe such thoughts, focusing on what they can control, such as taking medications, making healthy lifestyle choices, and managing stress. CBT also helps patients develop coping strategies to handle symptoms and improve their quality of life. Mindfulness and relaxation techniques. Stress management is crucial for individuals living with heart failure. Chronic stress can elevate blood pressure, increase heart rate, and exacerbate symptoms of heart failure. Therefore, incorporating relaxation techniques and mindfulness practices into daily routines can be highly beneficial. Mindfulness, which involves focusing on the present moment without judgment, has been shown to reduce stress and improve emotional well-being. Meditation, yoga, and deep breathing exercises are effective methods to promote relaxation and reduce the physiological effects of stress. These practices can help heart failure patients manage the anxiety and worry that often accompany the condition, improving both mental and physical health. The link between physical and mental health. Lifestyle changes that support heart health can also improve mental health. A heart-healthy diet, regular physical activity, as recommended by a healthcare provider, and adequate sleep can help stabilize mood and reduce feelings of anxiety and depression. For example, regular exercise has been shown to increase endorphins, the brain's feel-good chemicals, which can improve mood and reduce stress. Patients who make healthier lifestyle choices often experience a boost in self-esteem and a greater sense of control over their health. This, in turn, can alleviate feelings of helplessness and reduce the emotional burden of heart failure. Small but consistent changes, like taking a daily walk, eating more fruits and vegetables, or quitting smoking, can have a significant positive impact on both heart and mental health. Medication and treatment for mental health issues in heart failure. For some heart failure patients, medication may be necessary to manage depression or anxiety. Antidepressants and anti-anxiety medications can help alleviate symptoms, but they should always be prescribed by a healthcare provider familiar with the patient's heart condition. Certain medications used to treat depression or anxiety may have side effects that could interact with heart failure medications, so it's important to work closely with a healthcare team. In addition to pharmacological treatments, therapy, whether through CBT or other therapeutic modalities, can be an essential part of a comprehensive mental health plan for heart failure patients. A combination of medication, therapy, and lifestyle changes can provide a holistic approach to managing both the physical and emotional challenges of heart failure. Taking care of your heart, body, and mind. Living with heart failure is undeniably challenging, both physically and emotionally. The connection between heart disease and mental health is clear, and addressing both aspects is essential for improving quality of life. By recognizing the psychological impact of heart failure and actively seeking help, individuals can reduce the emotional burden that often accompanies the condition. Through lifestyle changes, therapy, support from loved ones, and medication when necessary, it is possible to manage both the physical and mental aspects of heart failure. Remember, you are not alone. Many people with heart failure successfully manage the condition with the right treatment plan and emotional support. Taking care of your heart and your mind is just as important as taking care of your body. If you or someone you know is struggling with the emotional impact of heart failure, don't hesitate to seek help from a healthcare professional. Mental health is an integral part of overall well-being, and it's never too late to start taking steps toward a healthier, happier life. If you found this video helpful, don't forget to like this video and subscribe to our channel for more content on heart health and wellness. If you or someone you know is living with heart failure, feel free to share this video with them. It might make a positive impact. Thank you for watching and see you in the next one.